Hi, and welcome to the Denver Health NICU. My name is Hannah Antista, and I've been a nurse here for 5.5 years. Your NICU care team has come together to make this video to give you an introduction to the unit and provide information and support. We understand for many of you, your baby being here was not what you were expecting when you thought about the birth of your child. We are here to support not only your baby, but you as well. This may be a lot of information for parents and families to process during a time of stress. If you have any questions following the video or at any other time during your NICU stay, please ask your nurse or any other NICU staff for clarification. Every baby in the NICU is connected to a monitor. We do this to ensure your baby's safety. A typical monitor looks like this. The green number represents your baby's heart rate. The appropriate range for a baby's heart rate is 100 to 200 beats per minute. If your baby's heart rate is outside of this range, the monitor will alarm and your nurse will come in to check in and make sure everything is all right. The blue number represents your baby's oxygen saturation. There are different ranges for this depending on how much respiratory support your baby needs. However, generally we like this number to be over 90. The white number represents your baby's respiratory rate. The appropriate range for your baby's respiratory rate is 30 to 60 breaths per minute. There are other types of measurements we can add to the monitor if we need to. If you notice additional colors or numbers on the monitor in your room, your nurse will provide more information. You may also be wondering how your nurse knows if the monitor is alarming if they are not in the room. At the desk, nurses can see all the NICU patients and respond to alarming monitors even if it is not their assigned patient. Your nurse can also see all of their assigned patients from any of their other patients' rooms. If your baby's monitor is alarming and your nurse is taking care of one of their other babies, they can see what is happening on your baby's monitor and react appropriately. While your baby is in the NICU, they may need extra help to maintain their temperature. You may see your baby in what we call an isolette instead of a crib. Isolettes allow your nurse to keep your baby warm, protect your baby's skin, and keep your baby safe. Evidence suggests that babies in the NICU have better outcomes when they are allowed to sleep and rest without being disturbed. We have what we refer to as care times in the NICU to allow your baby to rest and grow as much as possible. Your nurse will discuss specific care times for your baby with you. At the care times, we will change diapers, take your baby's temperature, feed your baby, have you hold your baby, and make sure all of his or her vital signs are good. We encourage parents to be involved, and your care team is committed to teaching you how. Every morning between 9:30 and 11:30, the care team gathers for what we call patient rounds. This is a time for everyone involved in your baby's care to discuss our plan for the day and answer any questions from parents or caregivers. We encourage parents and families to come to these rounds and ask questions about anything that is unclear or anything that you are curious about. We also have social workers in our NICU who are here to support you and offer any resources you may need. Typically, our social workers will talk with you at the beginning of your baby's NICU stay to learn more about you and your family and offer any resources or programs that your baby may qualify for. They are also available to you as needed throughout your baby's time in the NICU. The NICU is a secure unit. That means every time you come into the NICU, you will need to sign in at the clerk's desk. You will have to be let in at the door by the unit clerk. The nurse or unit clerk will review the visiting policy with you shortly after your baby is admitted. There are business cards in every room with the number to the NICU. When you call for updates on your baby, you will be asked to provide a security code. You can ask your nurse where to find this code. In every room, there is a call light. Before leaving the room, a nurse will make sure the call light is in reach, especially if you are holding your baby. Please press the red button to call for your nurse with any concerns and to help you put your baby back in their crib or isolette. When you first come into the unit, you will walk by the Robin's Nest. This is where you will eat any meals in the NICU, as we do not allow food or drinks except water in the baby's rooms. Your food tray will be delivered to the Robin's Nest instead of your baby's room. This is also where there is a restroom. We ask that you scrub your hands thoroughly in the Robin's Nest before entering the NICU. You will find a sink and scrub brushes there. When you come in, you will go to the unit clerk's desk and sign in. If you need help finding your baby's room, the unit clerk at the desk will help you. You will find there are 2 nurses stations when you walk around the unit, 1 on each side. Sometimes, if all the rooms are full in the main NICU, we may move your baby upstairs to the 4th floor. A nurse will call you when this happens. When your baby is moved, take the elevator to the 4th floor and follow the signs to the NICU on the left side. You will buzz in the same way upstairs on the 4th floor as you do on the 3rd floor. Upstairs, you can eat in your baby's room. Your baby will still be connected to monitors that can be seen at all nurses' stations. Thank you for taking the time to watch this video. We look forward to taking care of you and your little one. Remember, if you have any questions, the NICU staff is here at any time to help answer them. We want to make your time with us as stress-free as possible, and no one can replace the valuable role you play as a parent.